A new year means another candle on the birthday cake as we continue our quest to stop the aging process. Our Rachel Kay has a look at the top plastic surgery trends from the basic to the bizarre.
Mama's got a brand new body. Mommy makeovers are all the rage in plastic surgeons' offices, and registered nurse Michelle Hartog of the Bougainvillea Clinic explains why.
I think, after you've had a baby, things definitely aren't where they used to be. And so I think a lot of people, look for breast lifts, or maybe, sometimes just particularly after breastfeeding, the breasts are definitely not as perky. So implants, we do fat grafting to the breasts, tummy tucks, sometimes a little liposuction. I think it's important to wait at least 6 months after you finish nursing or after you've had the baby, at least minimum. It all depends on how much you do, like anything else. Breast lift, a breast augmentation, typically people do really well with, week, 10 days, they're good. Tummy tuck is a little bit more because you definitely need to take at least a week off work. But, sometimes as far as getting back to normal activities, the thing with the tummy tuck and with breast augmentations, we don't want you lifting anything heavy for about a month.
Hartog recommends you wait a year after you've given birth and have the procedures done when you're finished having kids.
I don't think you're ready for this yet. I don't think you're ready for this. My body too delicious for your body.
Apparently, we don't have big enough booties, and butts are big right now, which is why the butt lift is rising in popularity.
I personally like to take things away from that area, but anyway. But there are people, and particularly I think a lot of the Asian population really likes the buttocks implants, and it's typically other people. I think it's a cultural thing. I think certain cultures really like to have a lot of junk in the trunk, and we can take fat from your stomach and from your hips and your thighs, and we can augment the buttocks area. Implant will last forever till you take it out.
Right.
Yeah,
you
the
don't
fat,
need to get it redone or
not
anything.
Not typically. I'm sure sometimes at some point you might need adjustments and stuff, but it's more of a solid implant versus like a saline or something like that.
Maybe the strangest of the new cosmetic trends are eyebrow transplants.
A lot of people overplucked, and when you get to a point, sometimes it doesn't come back, and sometimes with certain medications, chemotherapy, sometimes people lose their eyebrows and it doesn't come back. And but you can do eyebrow transplants. I think the easier way to go is to use Latisse.
And the most requested procedures?
I think still breast implants and lipo, probably even breast implants more than anything.
And as always, consult with your physician before undergoing any kind of procedure.